Hello everybody, welcome to DHI. This is George Peter here, music director, lyricist and singer. I used to work with a band called 1380, which happened to be one of India's foremost rock bands. And apart from that, I've been working with the great legend Mr. A.R. Rahman, the Oscar winner. I get to travel a lot. I see a lot of places around the world. I've actually been on 2 world tours with the maestro, A.R. Rahman. The kind of travel plans, the itinerary that keeps changing all the time, the weather, you name it, the water. I started noticing that, it's affecting my hair. And I decided to go through a process. I somehow found that DHI was the ultimate so far till date. As of now, it's considered to be the most efficient. I would like to talk about on behalf of DHI because I believe in it. The thing is, you need to spend this one day, maybe just a few hours, maybe 4 or 5 hours, and then you get this thing sorted out, your hair, and it basically gets you onto your, it basically boosts your morale, and you understand that at the end of the day, it's your own hair. It's not artificial. DHI rocks in direct hair implants. Super.
I'm Kostas Giotis. I'm the DHI founder. DHI Medical Group has a vision. Our vision is to offer each and every one of our patients the best possible results. If you are considering hair loss treatment, I would suggest do your research, but do come to DHI, speak to our experts. We have 40 years experience, have done it ourselves, we know how you feel, and we'll guarantee you a fantastic result.
Hi, my name is Siddharth Kannan. I talk for a living. I have a radio and TV show. A couple of years back, I started losing hair, and obviously, I did lots and lots of things. I sat under a laser cap in Advanced Hair Studio. When I did the strip surgery about 2 years back, it was terrible for me, honest to God, because when I was doing the surgery, I was in pain. I was screaming, shouting. But then when DHI was happening to me, I was enjoying myself. I didn't even feel there was a surgery which was going on. As you noticed, 30 seconds back, these 3 doctors, I call them awesome threesome, were working on me. My face is not swollen at all. So pain is less, actually no pain at all. No swelling, easy procedure, and trust me, from a man who's had a disastrous strip surgery, with all due respect to people who work on strip surgeries, go for DHI.
I can't believe that, how quickly they change my image after one session, and still a couple of sessions are, remaining, and we have to do 1 or 2 more sessions. But I'm really happy that I doesn't need the other session.
Hi, my name is Gaurav Gera. I'm an actor by profession, and I have been working in television and films for a while now. And my problem was that I was losing hair. So I consulted a lot of people. I found out a lot about what procedures to go for, and I shortlisted and selected DHI. And I'm very, very happy with the results because it was very painless. It's natural growth. Actually, this is my 2nd session I'm going in for. So my hair is back. It's been like 5-6 months. You can see, I'll show you we can see the pictures before and after. So So this area looks much denser, and that is why I'm a satisfied customer, and I've come back again for a second session to fill it up more. And DHI, direct hair implant, is also, as in I didn't want too many people to know about it, so it can really, they just take out individual hair. It leaves no scar at the back of the head, so I can shave my head like if any role requires me to shave my head, I won't have a scar on the back of my head. So this is the latest technology, and I'm very, very happy with it, and I'm happy with the result.
I've been researching through the internet, and I've been speaking to other doctors like dermatologists and plastic surgeons who are friends of mine, and everybody seems to think that DHI does have a one-up on other techniques, mainly because when you do a DHI, you're using a very small punch or implanters. So what happens is the trauma to your scalp is very less, and if the trauma is less, the healing time is faster. So you don't have to worry about too much about the uptake, because there will be a higher rate of uptake of your implanted hair because the trauma to these areas are much lesser. And seeing the setup that they have, it seems very professional, and so I decided to go with it. I was extremely concerned about the pain and discomfort, but in fact I slept for at least 2.5 hours through the procedure, initially because I didn't feel anything, just a very mild prick, which was very, very tolerable. And I'll be coming back for my review in a few days time, and tomorrow I'm going to come and get my donor area in the back washed here at the clinic. And I think it was fantastic. I mean, when I started, it took me about 2 years to decide to have this procedure. 4 months after I met Dr. Viral Desai for a consult to work up the courage. But now I think, why did I waste so much?
What was your experience, the extraction experience?
Yeah, it was good. I mean, when I came in, I was not sure as to what to expect. And, whatever research that I had been doing with regards to how to improve on my density as far as hair is concerned, Google searches and everything were giving vague answers. But when I came to DHI, it was good because firstly and most importantly, which I think a lot of people are going to be afraid of, is that it's not painful at all. Secondly, the doctor is a thorough professional, and the interactive level that he had with me even while he was working on me, that itself gave me confidence that the entire process is going in the right direction. So yeah, it was a good experience. Now I'm just hoping that the results come up as quickly as possible. As I said earlier, the doctor was extremely alert in what he was doing, and after the procedure was done, I think it's going to make a difference, and I'm hoping so. And so.
Was it painful?
No, it was not painful at all. In fact, it was, like I said earlier, I thought it would be painful.
Mm-hmm.
But apart from the anesthesia going in, I think the rest was absolutely perfect. So there was no pain at all. So yeah, it was good.
Dr. Ben Chow runs the clinic in Geneva. He's also had a great result as a DHI patient. When anyone asks Dr. Ben Chow what it's like having a treatment, he knows exactly what it's like, every step of the way. On this occasion, the doctor is back for a final session to increase the density on his crown.
I was convinced the first time I saw this technique, and for me, it's the best one. When you say to the patient, you will have no scars, this is the strongest point.
Dr. Ben Chow is a model example of what can be achieved with the DHI treatment, and he's proud to let everyone see his amazing results whenever he gets the chance.
My name's Simon Withington, I'm 36 years old and I'm about to undergo a direct hair implantation, no-touch technique. I've tried all sorts of lotions and potions, shampoos. I've even undergone a 3-month course of Propecia, which had no effect whatsoever. So basically I'm now at the stage where I've gone, enough's enough, I'm going to go for a hair transplant. I feel that my confidence will be boosted if I have a full head of hair.
Thank you, everybody. That was painless. It was absolutely brilliant. Thank you. Wow. I've got hair.
Yes. Tracy Bell. We work alongside surgeons from Direct Hair Implantation Global. What we do is we take hair from a donor area, typically at the back of the head, without any change in density of the hair. Then what we do is individually place them into the donor area, normally at the front of the head, or the top of the head. We can even do eyebrows or beards. The response we have from people who have DHI is fantastic. It changed their lives. This was me a year ago. This is me now. We can guarantee our results and we can attain the results that you want to achieve. Call us for your consultation.
Today it is an international meeting of hair restoration experts.
Today we've seen all sorts of female hairline design, male crown modifications. So, you know, the full approach.
We transplanted hairs using follicular unit extraction from the back to the front using scalp hair, but also some chest and beard extraction, and the results have been phenomenal. It's just a great technology that's at use here.
The session this morning was impressive, and we could discuss among the most well-known experts from all over the world.
I found myself the session very interesting and let's say interesting for the future steps, what to do.
And we saw a great variety of hair loss types, one pertaining to women.
This is an exciting case because this young lady had her hairline dropped and the density of the hairline increases appropriately away from the front.
Hair loss in women is very devastating, and if we can help these women to get their hair back, it makes them feel better and look better. So I think it's a great job. Congratulations.
I've been attending the meeting from last 7 years, and it gets exciting every time. Newer things, newer concepts. You know, we're talking about the direct in, which is going to be the future of hair transplant. We're talking about stem cells. We're going to talk about PRP, which are with platelet growth factors and all. I think it's a very, very exciting time here.
DHI, dopo te le